How do funding challenges impact LGBTQ plus policy change efforts? Imagine trying to build a bridge with limited tools and materials. That's what many LGBTQ plus organizations face when funding is scarce or uneven. Funding challenges are a major obstacle to making lasting policy changes for the community. When organizations lack enough money, they cannot fully advocate for legal protections or support services. This means fewer campaigns to fight discrimination or improve healthcare access. Without proper funding, it becomes harder to gather research, run outreach programs, or push for new laws. Many groups struggle to get funding because funders often don't understand or recognize the diversity within the LGBTQ plus community. For example, bisexual and transgender groups tend to receive less financial support than gay and lesbian organizations. This gap limits their ability to influence policy or serve their communities. It also slows progress on laws that protect gender identity or prevent discrimination at work. When funding is low, it's even tougher to advocate for transgender rights or address health issues like HIV/AIDS, especially for marginalized groups such as Black men who have sex with men. Federal budget cuts make things worse. When the government reduces spending on health, mental health, or research programs, it directly affects LGBTQ plus communities. Agencies like the Centers for Disease Control and Prevention, the National Institutes of Health, and the Substance Abuse and Mental Health Services Administration often see their budgets cut. This reduces funding for HIV prevention, mental health support, and research on LGBTQ plus health issues. Fewer resources mean less data, less outreach, and weaker public health responses. Federal policy shifts can also cause instability. Changes in government orders or priorities can lead to loss of data collection, funding, and support for LGBTQ plus organizations. This creates uncertainty and makes it harder to plan long-term advocacy efforts. Economic barriers also play a role. Many LGBTQ plus individuals face higher poverty rates because of discrimination and lack of legal protections. This economic insecurity limits community resources and political influence, making it harder to push for policy change. Funding for economic opportunities like job training or housing support is often limited too. Most grants focus on homelessness or housing, leaving workforce development and food security underfunded. When organizations operate with fewer resources, they have smaller staff and less capacity to run campaigns or support legal reforms. Without enough funding, efforts to pass non-discrimination laws or expand health care are weakened. Addressing these challenges means raising awareness among funders about the importance of supporting all parts of the LGBTQ plus community. It also requires sustained government and foundation support to build strong advocacy networks. When funding is adequate and equitable, organizations can better fight discrimination, improve health outcomes, and push for meaningful policy change. In the end, funding challenges slow down progress but do not stop it. With targeted efforts and increased support, the community can overcome these hurdles and continue to make important strides toward equality and justice.